So good morning, everyone. My name is Barbie Holland, and I am the Director of Membership Services with the Greater Charlottetown Area Chamber of Commerce. Today's Lunch and Learn is on virtual health services provided by Teladoc and the Chamber Group Insurance Plan. Before we get started, I would like to acknowledge that the land upon which we gather is unceded Mi'kmaq territory. Abegweit, or Prince Edward Island, is covered by the historic treaties of peace and friendship. We pay our respects to the Indigenous Mi'kmaq people who have occupied this island for over 12,000 years, past, present, and future. So thank you for joining us, everybody. Today, I am happy to be joined by Annette Ulc of Teladoc Health and Shayne Connolly with the Connolly Group, who will be leading our session today. Annette is a senior client executive at Teladoc Health. She joined Teladoc Health, previously Best Doctors, in 2012 and has more than 20 years of experience in the area of benefits. At Teladoc Health, she works with a diverse portfolio of clients, TPAs, and advisors. And today, Annette joins us from Toronto. Shayne, a certified health insurance specialist, specializes in individual and corporate life insurance and estate planning at the Connolly Group, as well as employee benefit consulting, as with the group health plan with the Chamber. So welcome, Annette and Shayne. And I think we'll now hand it over to Shayne to get started. Just a little housekeeping. If you have any questions throughout the presentation today, feel free to leave them in the chat. I will be watching that. Or if you want to raise your hand, we can open the mic if you feel comfortable to share your question. Or at the end, I will have the Q&A. So we will make sure we answer any questions that come into us today on our program. So over to Shayne.
Thanks, Barbie, and welcome everybody on this week of messy weather here in Charlottetown and on the island. Nice to see the sun shining finally. Want to welcome everybody attending today on behalf of Connolly Group. We manage the employee benefit program on behalf of the Chambers of Commerce here in Charlottetown. And the benefit program is a wonderful product for you and your employees. And not knowing who's attending today, some of you may actually use our services now. We're extremely excited to have Annette here from Teladoc to speak about their suite of products, and she'll go into detail on them. But just want to mention that those of you that are members of the Chamber Group Insurance Plan now or are considering it, Teladoc Virtual Health Services are a complimentary benefit associated with being a part of the Chamber Group Insurance Program. We've been blessed to work with this particular product now since the early 90s when my dad was involved, and we've seen many changes over the years. And Teladoc is one that, especially in these days of COVID lockdowns and working from home, and the inability to see your physician as regularly as you may want. This is a phenomenal service and free of charge for anybody that has the Chamber Group Insurance Program in their kind of benefit piece in their companies. So without further ado, I'll hand it over to Annette to speak in more detail about the fabulous services available to you on the Teladoc platform. Welcome to PEI, sort of, Annette.
Thanks, Shayne. It's great to be in PEI, sort of. It's the only province that I have yet to step foot in, and I would love to be there one day and be able to present to you in person and speak to you live. So let's hope one day this pandemic subsides so we can go back to our normal lives. But thank you for having me here today and to provide you with an overview on the virtual health services that Teladoc Health provides. If I can move these slides along here. Okay, so I wanted to start by providing you with some information which you may well know, and it's in regards to the benefits of virtual care. You may have noted that with the pandemic, we have had to access a lot of virtual services in our day-to-day lives simply to be able to get by. And virtual healthcare is another such service that we are thankfully able to provide so that folks can still continue to get the care that they need. The benefits of virtual care are manyfold. One is that definitely you're getting access to quality care when you need it the most, and it's on demand, so you don't have to wait for an appointment. You're able to access the services that we provide through Teladoc Health on demand should you need, or you can even book an appointment should you wish to do so. There's no transportation costs because you're able to access them from your very own home. You're taking little or no time off of work because, again, you're not having to leave home to access these services. And for those of us who are taking care of young children or our parents, we're also not needing to get a sitter in order to be able to access healthcare services due to the fact that we're able to conveniently access them online. Our physicians resolve a broad array of healthcare issues, either by phone or video. And so that's eliminating long wait times and delayed care. Delayed care affects the outcome with one's healthcare, because if we're delaying and getting the support we need, or if we're having to wait to obtain that support, we're either getting worse, maybe missing out on work or our family life. So having access to a virtual service, an excellent virtual service, I might add, really gives folks the ability to go on with their day-to-day. We're also able to provide access to global experts when we're reviewing a diagnosis or treatment plan. So I'll be speaking about two different services here today that are available through the Chamber's plan. And so, so you have access to services that are for acute need and as well for a longer term need. Members and their families feel better, faster, and you see as employers an increase in productivity due to the fact that your employees are well. I added the chart to the right here because this is actually coming from our PEI utilization in 2021, and what folks have said they would have had to resort to had Teladoc not been there in order to provide care. And as you can see, between 60 and 88% of the folks that have accessed the service in 2021, they would have had to travel to get care elsewhere had the service not been there for them. We provide a full spectrum of care, as I mentioned, from something very complex to one that could be more acute and less complex. So it could vary as to what service is provided in that instance. So for instance, you have a child who wakes up with in the morning with a fever, the Teladoc telemedicine service is accessible at that time for an acute need. Someone who might have pink eye, again, the Teladoc medical telemedicine service is accessible where one can speak with a physician right away. Moving along the chart, you can see that folks will be accessing for issues that might be longer term. So for instance, someone who needs to seek a specialist in their community or is looking to review a diagnosis and treatment plan for its accuracy. Here, our Teladoc Medical Experts service, which was previously known as Best Doctors, comes into play. So I'll start with a review of the telemedicine services so that you get a nice overview of what that service entails. The key features of the service is that members have 24/7 access either by phone, web, or our mobile app. A visit is available within an hour, so we have an hour turnaround time. However, folks can also book an appointment within 2 to 3 days of accessing the service so that they can book it at a time when they're available. Our physicians are all board certified with the Canadian College of Family Physicians. The service is available in both English and French. And when folks are traveling in the United States, they can receive care and prescriptions as necessary. The care will be provided by a physician in the United States at that time. So once we're all traveling again, that service is accessible throughout Canada and the United States. When we're prescribing, we send prescriptions to the member's pharmacy of choice, so it's very convenient. There's also an option for online pharmacy. So if you do utilize an online pharmacy, we can also access those pharmacies in order to send your prescriptions. And we provide engagement support to drive the utilization of the service. So there's a number of resources that are accessible on the My Benefits site that the Chamber's plan provides. How does the service work? It's quite straightforward. A member completes a medical history, similar to the paperwork that one would fill out when you're seeing your family doctor. You know, they give you that pad of the little clipboard, and they ask you to put in your medical history and so forth. The very same thing happens, only it's online through this service. So what we encourage is that folks register even when they don't require an appointment, so that when they do require that first appointment, they're able to quickly access the service without having to take the time to register all of their medical information and medications, for instance. They then request an appointment that's scheduled within an hour, or as I mentioned earlier, the appointment time could be within the next couple of days. From there, a visit takes place with a physician, and the physician will first review your medical history and upload any images. So you can upload images of whatever the condition. If it is a condition where you can send an image, of course, you can upload those into our system so that the physician can review those prior to getting on the phone or on the video with you for that visit. So the visit can take place either by video or by phone. And then the physician diagnoses the member who utilizes the service, and if necessary, provides a plan forward, and also, if necessary, can prescribe medication that is sent to your pharmacy of choice. Insofar as the conditions that we treat, as you can see from the list, it's just kind of a short list of the conditions that we treat for, just to give you an idea. There are, however, some conditions that we do not treat or prescribe for, and those, of course, would be medical emergencies. Those we would advise folks to go to their emergency room, their local emergency room. Also, we do not provide prescriptions to narcotics and analgesics and controlled drugs. So our doctors are very disciplined, I guess is the word, in how they prescribe and ensure that they're prescribing only when it's appropriate. I thought I'd share an example of my own Teladoc experience. Actually, this is one of my Teladoc experiences. I also experienced the use of the service back when the pandemic first started. I was in the habit of watching a lot of CNN at the time, trying to learn more about the virus so that I could help protect myself and my family. Probably not the best source, but it was one source. And I had been watching a story where they were speaking about children, and having a symptom of COVID at the time for children was that their toes would turn purple. And my son happened to come into the room at the time as I was watching this, and I said, well, that's strange. And he said, oh, well, I've got that. And I said, what do you mean you've got that? He said, yeah, my toes are all purple on my left foot. And I said, well, let me see that. And I had a look, and indeed his toes were purple. And so, at the time, we didn't have vaccines. There was a lot of fear. I said, I'm just going to call the Teladoc service to see what they say and what they advise. And I did. And I spoke to a physician who did a thorough kind of analysis of what was going on. I had uploaded the pictures of my son's toes. And the doctor said it was a good idea for us to take him into a COVID testing center and have him tested for COVID, because it could be a possibility that it was COVID. So knowing that, I then took it upon us to take him in to get tested. He did not have COVID, which was a relief at the time, but it was nice to be able to get that medical advice without having to leave home until I really needed to actually leave the house. My own experience was not too long ago, actually. I had a swollen finger and pain, as you can see from the image there. This is the image that I shared with the physician at the time. I had this bad habit of chewing my fingers, and I guess I went a little too far, and it caused what I thought was an infection. So, not wanting again to visit my family doctor, I contacted the service. In addition, my dad was in a long-term care facility at the time, and I really didn't want to expose myself to anything in order to then have to bring it into the home that he was in. So I reached out to the service via the app. I requested a visit. Within 30 minutes, a physician contacted me. They did diagnose me with an infection, prescribed some antibiotics, which they sent to the pharmacy of my choice. It was a persistent infection, I have to say. I actually had to call the service back a week later to say, that the infection still hadn't subsided. So they prescribed an ointment and a different antibiotic at the time, which then worked. And I never had to leave home to access any medical services. Didn't have to sit in a waiting room with others that I feared could potentially have COVID. We are making an impact with the service. These are just some comments that some folks provided who accessed the telemedicine service through Teladoc just this past year in 2021. 100% of our users in PEI rated the service as excellent or good in 2021. And I did receive some utilization reporting for January, and we're still hitting that 100% batting average for PEI. Folks are very satisfied with the service. They've indicated that it's easy to navigate, and the physicians are really easy to speak to and to understand. And now I'm going to turn it over to our Teladoc Medical Expert Service. So for those of you that have had the Chambers plan, you may be familiar with Best Doctors, and that was the name of the service prior to us moving to the Teladoc Medical Experts name for the service. The reason that we moved to the Teladoc name is to use the Teladoc brand. As was mentioned earlier, I'm with Teladoc Health. That is the corporate brand for our company, and that is the company that I work for. And all of the brand names and consumer brands that we have under the Teladoc Health banner are switching over to include Teladoc in some form or fashion. And that's just for ease of use, so that when you're accessing our services, you're accessing one provider and you're getting the care you need for what's necessary at that time. Some of our service names have changed. So if you, again, are familiar with our services, you'll see that some of the names have changed. And this all took place as of January 1st. And important to note that our phone numbers haven't changed. So you're still able to access the same fantastic physicians and services and member advocates that support the program through the same phone numbers that you've utilized in the past. Who are the physicians that are within the network of the Teladoc Medical Expert Service? Our physicians have to meet a rigorous competence criteria in order to be part of our network. They have to be subspecialized in the area that they are focused on. They have to be practicing purely on that disease or medical condition. They have to be known by their peers for that, for practicing in that area of medicine. They have to be published extensively. So they have to have been published in medical journals, for instance, and they have to also hold a senior academic position with regards to that condition. So they're the physicians that are teaching other physicians. So they do have obviously extensive qualifications that they need to have in order to be part of our network. Who's eligible for this service? So this service is a little bit different from the telemedicine service, is in that not only are the Chambers Plan members able to access the service, as well as their spouses and dependent children, which is typical of most health benefits, but the Teladoc Medical Expert Service is a little bit different in that parents and parent-in-laws also have access to the service. So this is a great way to provide the Chambers Plan members with peace of mind, knowing that all of their loved ones are getting the help they need. And we know that our parents, when they become elderly, do require more medical services and attention than they did back when they were our age, for instance, or my age. There are 4 services that are offered as part of the program. The one that we're most well known for is the Expert Medical Opinion Service. This is where we're providing, as you've noted, all of our services are virtual. We're providing a virtual second medical opinion. And the way we do this is we're collecting the medical records and test results that our members have obtained from the physicians that they've seen in their community. And our experts are reviewing those in order to provide our opinion as to the correct diagnosis and treatment plan. What happens is we ask the member to sign a release form, which gives Teladoc medical experts permission to collect their medical records from their treating physicians and the facilities that they visited. All this is done at Teladoc's expense. There's no fees or disbursements of any kind and of funds of any kind in order to have us collect those medical records. An important thing that we do also is that we retest pathology. So if there is a biopsy, if it's a condition where you've had a biopsy done, we will retest that pathology because we want to ensure that when our experts are reviewing everything, they're reviewing accurate information. If our results don't match the initial results that you obtained when you had the biopsy done, we will send the pathology to a second facility to be tested yet again. Again, because we want to ensure that we're providing information that is based on accurate test results. So once we've collected all those medical records, it could take a bit of a while to collect them. Some facilities have holding policies where they hold the records for 30 days before they release them to us, but we try to expedite everything as much as we can from our end. So it could take, perhaps 6 to 8 weeks to go through an expert medical opinion because of that medical record collection portion of the service. Once we've collected those records, our clinical team reviews them, does an analysis of them, and summarizes them. They then select one of our experts from any of the experts, as I mentioned earlier, that the qualified experts in our network. They cover over 450 specialties of medicine and subspecialties of medicine. So we'll select the one or ones that are most qualified to do the review. They then review the summary. They provide a report back to our team of physicians for quality assurance. And this report will contain their opinion as to the accurate diagnosis and the best treatment for that condition. The report is then shared with our member advocate. Now, the member advocate is the person that works with our members from start to finish of their case. In the past, we utilized nurses quite a bit to be member advocates. We are moving into having more physicians provide that aspect of the service. As our cases become more complex, we're having physicians address those cases. Anyway, so then the report is shared with our clinical team does that review and the quality assurance. They then share it with the member advocate who shares the report with our member. The member will then typically take the report into their treating physician and say, hey, this is what Teladoc Medical Experts has uncovered. They've indicated that this treatment would possibly be a better solution than the treatment I'm currently undergoing. What do you think? Should I go ahead with this? And it's really a discussion between the treating physician and their patient to decide how they want to move forward with any recommendations that Teladoc would make. The other services that are provided would be Find a Doctor. This service used to be called Find Best Doc, so you might be familiar with it. This is where we help locate specialists in one's geographic area. So it could be a gastroenterologist, a cardiologist, an oncologist. We're able to provide the names of several in their geographic area, along with their qualifications. And importantly, we're also able to advise as to how long the wait list will be for that specialist. We do contact each one before we provide that information to our members so that we're able to gauge kind of roundabout what their wait list might be, because that'll also help our members to decide which specialist to select. Importantly, to note here is that we can provide the information, but by law, as we are not the treating physicians for our members, we cannot make the actual referral. So the member will have to take the report that we provide into their treating physician in order for them to make the referral to the specialist. We can also assist with finding family doctors in one's community through the Find a Doctor service. Care Finder is a service that was known as Find Best Care. So Care Finder is where we're doing a similar search, but we're doing it for folks that are looking for care outside of Canada. So outside of the Canadian healthcare system. So we're able to provide the names of specialists and the facilities that they may work out of, their qualifications. But again, important to note that because it's outside of our healthcare system, it would be at the member's cost to see the specialist and also to travel to see the specialist. And then finally, Personal Health Navigator. That service was known as Best Doctors 360. This is where we're helping our members navigate the healthcare system. So if they have questions about their condition, maybe they're newly diagnosed with diabetes and only had 5 minutes in with their physician and didn't think to ask all the questions they wanted to ask. Our member advocates are pleased to answer questions around their medical condition. We're also able to help find resources in a member's community to support their needs. Maybe they are looking for a support group for cancer sufferers or a chiropodist in their community, maybe a psychologist in their community. So here our member advocate can do a customized search for whatever resources they might need. We can also answer questions in regards to what the risks are with having to wait to undergo procedures. I know that here in Ontario, we've had delays in surgeries and treatments because of the pandemic, and it's likely happening in PEI as well. So speaking to our nurses about what the risks could potentially be could provide some assistance to our members to know, what the factors are that are going to be, I guess, either mitigated when their surgery or treatment is over, and also get some additional information on what they could do currently in order to support whatever condition they may have. Why do folks call Teladoc medical experts? Actually, half of the time, almost 45%, symptoms aren't improving. So folks will contact us and say, I'm undergoing treatment for this condition, and I'm just finding that it's not working. I'm taking this medication and it's supposed to be alleviating my symptoms, but I'm still not feeling well. And so half the time, that's why folks are contacting us. Another 19% of the time, folks need help deciding on a treatment. So they may have been diagnosed with a cancer, for instance, and they're sitting in front of their oncologist, and the oncologist says, well, you can do chemotherapy, you can do radiation, you can do surgery, or you can do watchful waiting. What would you like to do? I don't know about you, but being a layperson, I wouldn't have a clue what would be the best option for me. So having an expert in that area of medicine weigh in and say definitively, Annette, this is your best course of action right now, would give me peace of mind that I'm selecting the best course of treatment at this time. 14% of the time, we have folks that don't have a diagnosis. Maybe they've seen 3 or 4 different specialists and they're still unable to figure out what's going on. Teladoc is able to look at everything under one lens because we're collecting medical records from each of these physicians. So we're able to say more conclusively what's going on. And so it's a great way to use a service as well. 8% of the time, folks are questioning the need for a surgery. Another 8% of the time, folks don't understand their diagnosis. And there are a few skeptics out there. 6% of the folks that access the service are just not trusting of their doctor's advice and want to get that second opinion. We cover a full range of conditions. We like to say that we treat folks from head to foot. As you can see, there are a great deal of conditions that we provide support around, but please don't limit yourself to this chart. Folks can access for most any condition. I would say chronic conditions as well, such as diabetes and rheumatoid arthritis, migraines, fibromyalgia are also areas where folks can access the service. The only area where we're not able to do a medical second opinion, that expert medical opinion, is for a mental health condition. Because we're not seeing our members face to face, we're not able to say whether they were accurately diagnosed at the outset. Here, the supports that we can provide would be through our Find a Doctor service, where we can help find a psychiatrist in one's community, or through our Personal Health Navigator service, where we're able to provide other clinical resources and perhaps support groups in one's community. And then I thought I'd close with a member story. This is Ashifa. That's a picture of her there with her 2 kids. She had a small lump on her neck. It was biopsied and the result came back negative, so no worries. However, her doctor recommended that she have it removed because he found that the lump was changing in shape and it was also affecting her voice. So she did decide to go ahead with the surgery and it was successful. But as you know, when someone has something removed during surgery, they always send it off to pathology to test it. And when they did that, it came back and it said that she had metastatic squamous head and neck cancer. And this is a very aggressive cancer. So they immediately scheduled her to start 30 rounds of chemotherapy and radiation concurrently. And this is a very aggressive treatment. And to kind of preface, Ashifa didn't have any symptoms of being unwell. So she was very baffled as to why she even was diagnosed with this cancer. She wasn't feeling any weakness, no lack of appetite. She wasn't feeling unwell at all. So really went out on a quest to figure out what the source of her cancer was. So she ended up undergoing 16 different biopsies just to test to figure out what the source of the cancer was. She even had her tonsils removed because she was told that sometimes this cancer hides behind the tonsils. Again, couldn't figure out what the source was. And so knowing she had access to Teladoc, she contacted us. And in fact, she actually had her husband contact us and act as her advocate in order to provide support, because she just wanted to keep working as long as she could before she had to start undergoing the treatment. Her mother was also preparing to move from Toronto to Calgary, which is where she resides, in order to help care for her and the kids. So everybody's lives were pretty much getting turned upside down, preparing for this aggressive treatment that she was going to undergo. So we started the process of collecting her medical records and retesting her pathology. And we retested the pathology once, and we found our results didn't match. So we send it to a second facility to be tested again. And we were able to conclusively say that Ashifa did not have this aggressive form of cancer that she had been diagnosed with. What she did in fact have was an autoimmune condition that we needed to kind of figure out what it was. So we actually our clinicians connected with her physicians in order to discuss what was going on and to figure out what the issue was exactly and how best to treat it. So she was very pleased because she was able to receive the information about not having the cancer on the Friday before a long weekend, and she was supposed to start her chemotherapy and radiation on that Tuesday, right after the long weekend. So we actually got the results just in time. And her oncologist apologized to her, and as I said, connected with our medical team in order to get more information in order to better support her. So really a good news story because everyone was able to go back to their day-to-day life after that. As I mentioned earlier, the service is accessible via phone, web, or app. So if you download our app, you can set up your account. And as I said, best to register and get all that information in there whenever you do set it up so that it's all ready to go when you do have to access the service. And here are our phone number. Our app is available on the App Store and on Google Play. And of course, we have our web instance, which is teladoc.ca. And whatever services you have access to through the Chamber's plan, you will see, once you register, you will see the services that you have access to. So you're able to access whatever it is that you have access to through Teladoc. So that concludes my presentation, and I'm happy to take any questions that anyone may have at this time.
Thank you so much. Hi, Annette. I'm back, and hi, Shayne. I just want to share with everybody, I have it downloaded as an app on my phone. I've had it for quite a few years. So some great information in there. And just to let you know, Annette, we have 17 people joining us. So I certainly hope all of our members that are participating on the group health plan have some great takeaways. And anyone that's on the call that is not on the Chamber's plan, I encourage you to do so. And Shayne would be happy to answer any of your questions. And certainly if you're not a Chamber member, I can help you with that. And together, Shayne and I can make sure that you have access to all of what Annette just shared with us. So we'll keep an eye on the chat or the Q&A. If anyone has any questions, certainly take advantage of the expertise that Annette has shared. And yeah, Shayne has a question.
Well, it's not a question, it's more of a comment. As a member of the Chamber plan myself, I just wanted to pass along this, like Annette's situation. I had something pop up and it was a weird rash on my back and I couldn't quite figure out, and it was surprised me. It was a Saturday night. And so I reached out on my phone. The app is super easy to use. So reached out, contacted a physician on Saturday night. It was about 10:30 on a Saturday night. And in the discussion virtual, like by text, I uploaded, actually, sorry, when I went on the site, I uploaded pictures, sent them. And within 20 minutes, half an hour, I was on the phone with the doctor. They recommended a particular approach and something different than what I would have gone to. You know, you think, okay, get an anti-allergy med right away. And so they recommended the best approach. And literally within 20 minutes on a Saturday night, I had had some assistance and was able to act on it. So I know this is an extremely valuable benefit to have. And it works really, really well, super easy to deal with. And so I just wanted to reiterate and provide another example of how great the Teladoc product is.
Thanks. Great. Thanks, Shayne. And a couple of notes that just to reiterate again, 24/7 access. That's great. Saturday night at 10 o'clock. Who'd think that you'd need to get some medical expertise? A 1 hour turnaround. It's pretty impressive. PEI rated, excellent and good. So you know that there's other islanders using this service. And why they call 45% our symptoms are not improving. So that would mean that you might have already been diagnosed and have these symptoms, and then it's a second trip perhaps back to a medical physician or hospital or waiting room. So really, really great numbers. And another item I want to share and point out is sometimes we can all be that Dr. Google. You know, you want to Google your search and see what's wrong and why am I doing this and why. Well, right here on the group health plan through Teladoc, you have direct access to the professionals. So we don't need to self-diagnose ourselves, and we don't need to worry about why our children have maybe a rash or a bruise or whatnot. So go to the professionals and get that professional help from your app. And again, to everyone that's on the call, I would really encourage you to share this with your employees. And that's who we really want to make sure that they are seeing the benefit of you paying for group health benefits for your employees. And so make sure that they are aware. We will be sharing this presentation, so we'll make sure you have it in your hands. But please bring in your team and let them know that this is a huge benefit of them working for your company and your company taking advantage of the Chamber's Group Health Plan. So any, no questions? Okay, I guess that means that maybe your presentation was so wonderful and straightforward, Annette, that there was nobody having any questions. I'll sort of give it another minute, and if there's no questions, then we can let everybody off the hook here and maybe grab a little bit of your lunch hour. Nope. All right, there's nothing coming in. Okay, so now I would just like to thank Annette and Shayne for being our guests today. And thank you again to everybody for joining the Chamber. I know these are trying times, and I really want to make sure that we share as much with you as we can, even if it is virtually. So thanks for taking the time, joining us today on your lunch hour and being part of this Lunch and Learn with our guests, Annette and Shayne. Have a wonderful rest of your day. And thanks again. We look forward to seeing you at another Lunch and Learn soon.
Thank you. Bye, everybody.
Thank you, Annette. Thanks, Shayne.